From an autistic point of view, a series of short presentations looking at what it means to be autistic. Times they are a-changin', sang Bob Dylan in 1964. However, meaningful change in the context of how autistic children and their parents and carers are perceived by health and social care professionals has been painfully slow. For this first podcast, I'll be advocating for lasting and meaningful change for parents of autistic or disabled children. 16 years ago, my wife and I were encouraged to seek an autism assessment for our children by a local authority social services department. Less than 14 months later, we were victimised by the same department for simply following that advice. 15 years on, no apology has been offered, and much of that mental anguish remains. In July 2021, a damning research paper was published entitled Institutionalising Parent-Carer Blame by Luke Clements and others in association with Cerebra and the University of Leeds. The report highlighted the experiences of families with disabled children in their interactions with English local authority children's services departments. It is based on research that commenced in 2017 as a result of families making contact with the Disability Law Service and the Cerebra LEAP programme. This research paints a picture of a deliberate culture in which social care policies assume parental failings before assessing the needs of disabled children. The report goes on to criticise current national guidance such as Working Together 2018, which focuses on safeguarding children from parental abuse and neglect, whilst failing to address the assessment of support needs of disabled children where there is no evidence of neglect or abuse. Further, there is no requirement that social workers assessing the needs of disabled children have any experience in specific conditions, including autism. These policies interfere with the fundamental rights of families in respect of privacy, whilst local authorities routinely deny disabled children statutory assessments, including respite care. Typically, when parents approach their local authority for help to address the additional barriers they encounter as a result of their child's impairment, they find from the outset that they are treated in a manner that suggests to them that they are considered to be neglectful and/or abusive parents. The Case for Change, also known as the McAllister Review, commissioned by the Secretary of State for Education in 2021, concluded that parents were subjected to child protection investigations if they seek help, which in turn stops them from asking for the support they need, and that the whole system appears to be disproportionately spent on assessing and investigating families instead of providing support. In addition, that review found that families with disabled children felt that they were navigating a system that is set up for child protection, not support. This whole approach conceptualizes disability as a problem that can be prevented or remedied by short family intervention programs. In essence, this blames the family as the root cause of the problem, and that disability can be cured by setting parents' targets. This appears to be contrary to the UN Convention on the Rights of Persons with Disabilities. The impact on parents, such as my wife and I, has been devastating. We are amongst many thousands of parents who have been institutionally abused by this system, which is primarily concerned with potential safeguarding issues and perceived parental failings, rather than on support needs of disabled children and their families. In many local authorities, parents cannot get a social services referral unless they are perceived child protection needs, and these concerns prevented many parents from accessing respite or care support services for their children. The situation amongst parents of autistic children is particularly harrowing, with the focus usually being on seeing the parent as an unfit parent rather than focusing on the autistic child disability needs. Social work and autistic young people, an exploratory study by the Department of Health and Social Care, also in 2021, compiled by the chief social workers for both children and adults, says, and I quote, "The experiences and conversations we had showed a tendency to use social work assessment as an opportunity to determine parenting capacity through a child protection lens. Some families are being unnecessarily pulled into child protection process. Fear of being labelled a bad parent or concerns about being blamed for failing as a parent may limit a family's willingness to seek help." In many cases, including our own experience, the situation worsens if parents complain against the lack of service provision, as invariably they are then accused of fabricating the extent of their children's disabilities. Indeed, our children were placed under child protection merely for seeking a medical diagnosis which was, quote, impacting upon the children, when only 14 months previously the same local authority declared that parents should be commended for continuing to pursue a diagnosis of autism. The powers that local authorities present are considerable and present considerable and intolerable stress and harm amongst parents and families. Parental health and well-being are neglected, and children's needs are ignored at the cost of their well-being and future mental health. I welcome the fact that new statutory guidance and training has been introduced to address the specific needs of disabled children and their families, including the new strategy for autistic children and adults and fabricated and induced illness guidance from Dr. Judy Eaton, Kathleen Long and others. However, implementation will take some considerable time, and the current COVID pandemic has inevitably delayed this process further. Times they are a-changin', but parents and carers need to be at the forefront of these changes. New statutory guidance and mandatory training of social workers, particularly in the respect of autism, is most welcomed, but parent carer groups need to be informed and supported along the way, and the time to act is now. If you like what you've heard today, please subscribe and tell your friends and colleagues, and please tune in to my other podcast, Wired for Autism Presents Autism Conversations, a series of informal interviews with fellow autistics to spread autistic assessment and promote positive change for autistic individuals and their families. And why not check out my website, wiredforautism.co.uk.